Hi, I'm here today with Dr. Sandra Fortenberry, an associate professor of the Rosenberg School of Optometry, University of Incarnate Word. Dr. Fortenberry graduated from Abilene Christian University and the University of Houston College of Optometry, where she also completed a community-based family practice residency. Dr. Fortenberry is currently the Assistant Dean of Professional Advancement, where she oversees continuing education and professional relations at the Rosenberg School of Optometry. Dr. Fortenberry serves on the Board of Trustees for the Texas Optometric Association, and she's a past president as well. She's a fellow of the American Academy of Optometry and a member of the American Optometric Association. In 2013, she was awarded the Young OD of the Year by the American Optometric Association. In 2016, she was named as one of Optical's most influential women by the Vision Monday organization. I recently ran into Dr. Fortenberry at the TOA meeting where we had a great discussion, and since I've been so excited to welcome her to the show. So welcome, Dr. Fortenberry.
Thank you. Thanks for having me.
Oh, it's great. I mean, what a great career you've had. You're so interesting. I couldn't wait to get you on the show and tell the viewers about you. One of the things that I read about you and is all over the internet is about your tireless work ethic. You worked full-time while in undergrad. You're the first person in your family to graduate college. You're a mom. You were a practice owner, and now you're working at that practice after selling it. You're an associate professor. I mean, what don't you do? I mean, you're doing everything.
Yeah, I kind of stay really, really busy, and I'm blessed to have an incredible support system. No one gets here by themselves, and no one does all of this by themselves, so I'm thankful for all of that.
You mean me telling you all this doesn't make you think twice about, oh my God, it didn't freak you out hearing it? Because sometimes when you're doing as much as you and I and other people do, if you stop, somebody tells you what you're doing, you're like, oh my God, I need to slow down. Do you ever feel like you need to slow down?
No, I think I've always been this way. Even as a kid, I was very involved in extracurricular activities and involved in church. And I used to tell my mom, well, I'll sleep when I'm dead.
There you go. That's a great outlook. It's for some people, not for others, though. You've also been described by your students as fearless. Where does that come from, and what does that mean to you?
Oh, wow. It's quite a compliment. I think that comes from upbringing, you know, realizing that you can do anything that you set your mind to, and people are going to challenge you or put you down or, you know, try and keep you from attaining your dream. But you can challenge back. You can do everything that you know is right if done in a respectful manner. And I think that's just part of the way I was raised from my parents.
That's great. Yep, it all goes back to that, I think. Now, you opened a practice, I think around 2012. It was called it is called TSO Bandera. You sold it in 2015. You still work there, but you chose academia as a career. What do you advise our young viewers who are unsure of what modality they want to choose? What would you tell them?
Wow, I think there's so many great opportunities in optometry, and it's so flexible. You can work 7 days a week, or you can work 2 days a week, and you can have a great living at it. You can work in academia. Maybe the pronunciation of that word just depends on what part of the country you're from. But here in Texas, we call it academia.
Okay.
And, you know, it took me a little while to figure out what it was I wanted. I thought I wanted a practice, and I loved what I did, and I love my patients. But truthfully, when I got promoted to an assistant dean, I realized that was my true passion. I love advocating for optometry and optometrists. I love advocating on behalf of students who are trying to attain their dream. And it's a lot of fun to play out the ebb and flow of a semester. And so once I had the practice, I realized, ooh, this is really what I like to do. So I had to tell my husband, I think I want to sell the practice. And so he didn't take it too bad. So
now he was the optician there. Is he still there?
He's not. He has gone on and is the manager of a dental practice.
And his name's Jake, I saw. He's a manager of I'm sorry, say that again. He was the manager of what?
Of a dental
Of a
practice.
dental practice. Oh, awesome. Still in healthcare. Now, in your bio, it says that you completed a residency in community-based family practice. Can you tell our viewers exactly what that means?
Yeah, so when a student first starts thinking about what type of residency they want, they typically will try and narrow down to a specialty, a field, be it contact lens, ocular disease, things like that. So when I was in school, I couldn't quite narrow down exactly what I wanted, but I knew I wanted to be better, and I knew I wanted to start practice as the very best that I could be. And so one of the options was the community-based family practice. So family practice will let you sort of emphasize on whatever topics you like. In my case, I chose contact lens and disease. And so nearly all of my residency was focused on that. Community-based means that I was actually hardly ever in the school. I was more at an indigent care practice, the Good Neighbor Clinic in Houston. And it was just one of those clinics where probably the large percentage of the day I had to speak Spanish. And yeah, I got to care for a lot of great patients who wouldn't have received care otherwise.
That's interesting. You could have a residency in contact lenses or disease, but if you choose this, you can do multiple areas as it impacts the community. I assume that's what it
Yes.
means, right? Now, what were you feeling in 2013 when you were named the Young OD of the Year by the AOA?
Um, wow. I felt overwhelmed in a sense because I felt like I was simply doing my job. I was very honored to be recognized for the work that I would have been doing anyway. But I think a lot of that had to do with helping create and start the new school. I was here early on. I've been at the school since 2010 and helped, navigate those waters. Anyone who's been at a new school can tell you those first few years are a little tough. But mostly I just felt gratitude from everyone who thought I was worthy enough to receive that honor. And so hopefully, if anything, I can just encourage students who are either in school or who might be thinking about optometry. I don't know if you know this about me, but I did not get accepted when I first applied to optometry school. And I tell students now as we're advising them who want to apply, I say, you know what, I didn't get accepted the first time. I got to work and I did better and I applied again and I was persistent. And look at me now. I can become Young OD of the Year, a TOA past president, and I teach at a school. And I think if you want something bad enough, then you work hard enough for it.
Persistent, ambitious, these are all qualities that you need to climb that ladder. And nobody who falls down and doesn't get back up again gets there. So that was awesome. I mean, that's the biggest award, I think, in the industry. So congrats on that. Very, very, very impressive. Now,
Thank you. I don't know what'll happen someday when I'm not young anymore and they still call me Young OD, but I'll take it.
you'll take it, right, right. Yeah, at some point I became not a young OD. I feel young. I'm looking out of these eyes, but I know it's not. I'm not who I used to be, so that's hard to get used to. Um, Now, when one of the reasons you won that award, I'm sure, was based on the work you do advocating for your state and working with the AOA. When we met, you told me something that just blew my mind. Maybe I just had my head in the sand, but you were telling me Texas had the third worst scope bill in the country, and I was shocked. I think that with a huge organizations there, like, not to call anyone out, but just it's a very optometric state with Vision Source and TSO and Today's Vision and others. They'd have made more progress over the years than the states that I think of as having bad laws, like Massachusetts, New York, and my state, Maryland. Tell us about what Texas optometry has been up against over these years, and any unique challenges practicing optometry in Texas. If you could also tie it into the recent scope expansion effort.
Sure. Right now, we are in legislation. To give you a taste of what goes on in Texas is that session only happens every other year for 140 days. So it's already designed against you. It's difficult to pass laws. But we have a very ambitious team. We have a hardworking team. We have good grassroots. But even then, we are up against the Texas Medical Association, which is probably one of the largest PACs in the nation. So we're up against a Goliath here. And that's probably one of the biggest contributing factors. In addition to that, our Senate, out of the 30 senators, 3 of them are MDs and 2 of them are ophthalmologists. So there you can see some of our bigger hurdles.
I know you lecture, you teach at the school, you teach courses, you lecture, and you're a podium speaker, and you write a little. What are the topics that you're passionate about that you like to educate our colleagues on, our future colleagues?
Sure. At the school, I teach in the basic optometry, so I have the joy of teaching retinoscopy. I teach one of the first visual acuity lectures that they get. So I have a lot of fun in that basic optometry course. I teach in the basic contact lens lab, and then of course I see patients in clinic, and then I'm in their 4th year clinical case management course. So that's the type of teaching I do. But probably one of the most passionate things that I care to talk about to students as well as doctors and staff is communication skills. Communication is a two-way street, and even if the person that you're wanting to hear from isn't always speaking, sometimes you have to ask the question. And being able to ask those questions in the right way and the appropriate questions is just as important as giving the answers. And so I like to talk about just communication and ethics within your patient care and how you teach and educate a patient. I think all of those things are important. So that's a little bit my passion of what I enjoy and what I sprinkle in there in my lectures.
That's great. It's so important, the words you choose when you're engaging with a patient as well. Just a simple words that you use to explain a condition can make the difference between how long that conversation goes on or how you're perceived as a doctor. I always said in my lectures that your patients don't know what degree you have. Sometimes they come in and they'll say to me, I'll say, what brought you in today? They're like, well, I went to that optometrist down the street, but I wanted to see a real doctor. And I'm like, so what brought you in today? And then when we're talking, it's so crucial to deliver the right message. And if you don't, they don't know what degree you have. They don't know whether you were at the top of your class or the bottom of the class. All they know is that you met their needs. And often that is done in just how you communicate to them. So very important.
Absolutely. I agree 100%. Oftentimes when you get to know a patient and you find out whatever their interests are, I'm able to relate some of the things that I need to tell them in whatever interests them. For example, if they like cars, I'll relate it to a Ford versus Chevy type scenario. And then it kind of means a little bit more to them. Absolutely.
Well, this has been great. There's so much more. There's so many questions I want to ask you, but we have a limited amount of time. I do want to try and wrap it up, but what I want to do is hear about your interests outside of optometry and your family. Tell us about your kids. We heard about Jake.
Yeah. So my husband, Jake, he and I will be married 20 years this year.
Congratulations.
Thanks. We have 2 children, age 12 and 6, both girls, Olivia and Amelia. And we have so much fun with them. We're outdoors kind of people. We like kayaking and fishing and camping. But we do the indoor stuff too. We bake and just kind of have fun together. Right now, both girls are playing softball. So basically every evening is filled with somebody's softball game or practice. And I'm an assistant coach for the little ones team.
Awesome.
And so we just have a lot of fun together. And I think probably at the center of it all is teaching our kids how to be productive members of society. And that involves going to church and understanding your place in society and the importance of giving back. And so I think everything that we do, whether it's playing on a softball team to learn team skills and life lessons about losing graciously, or learning how to bake a cake and make sure that it comes out right and then share it with someone who might not have the opportunity to have sweets. Those are the kinds of things we want to teach our kids.
That's wonderful. Sounds like a beautiful family, and it sounds even more like you're doing it right. So that's fantastic. Well, Thank you so much, Sandra, for being here. This has been a really great interview. I have so many more questions, and now that I have this basic information on you, would you agree sometime down the road to come back and maybe once this bill is pushed through, we can come back and talk about what happened in the whole story? That'd be a great episode.
Sure, I'd love to. And for anyone who wants to help out in any way, focustexas.org is a site where you can go to help out Texas if you're so inclined. Even if you don't give money, please come to the site, sign up for it, and you can get the updates that are going on from Texas. Focustexas.org is actually a public education page so that the people out there can understand what optometry does. Likewise, be involved in your own state. You know, Texas has helped out Arkansas and Florida and other places like that when we get the opportunity, and it's important that we all stick together in this crusade. So
that's fantastic, and it's so important. That state goes, you're going to see a lot of other scope expansions go through as well. Such a huge state and such an influential state in medicine and optometry. All right. Well, listen, thank you for being here. Have a great week. Stay safe. We'll get through the end of this COVID thing pretty soon. And I look forward to the next time we're able to connect in person, as well as our next interview.
Absolutely. Thank you so much for having me. It was an honor to be here.
Great having you.